Well, on yesterday's show, our hot topic was all about family doctors, how easy or how hard they are to find where you live. The Northern Health Authority, for example, says it's short 48 doctors. Well, today, the BC government and the BC Medical Association announced a plan to find a family doctor for everyone who wants one by 2015. Part of the plan involves connecting patients and physicians over the phone. Dr. Margaret McDermott is BC's health minister, and she joins me now on the line. Hello.
Hi there.
So let's start with this telephone part of the plan. How will it work?
There is a possibility in some of the new incentives for family doctors to be able to talk with their patients on the phone. So in other words, provide some care by telephone rather than having an appointment. It will not be for everything. It will be for some kinds of problems and conditions. So say, for example, you have some lab tests, they're all normal. Your family doctor won't be able to bill for calling you up to tell you that. But there are some kinds of conditions where a patient, especially for more complicated things, where a patient may have, let's say they have emphysema and they feel like it's getting worse. A call to their doctor may be able to get them some advice over the telephone that will keep them out of the hospital, out of the emergency department, and it can be a time saver. This is one part of the program that we think is going to free up some time for family doctors and give them the capacity to actually take on more patients.
How much time would a phone treatment versus an office treatment actually save?
Well, part of it is the getting in and out, certainly on the patient side, but it's possible that it might save a few minutes here and there. It's also that family doctors do currently provide some care by telephone, but they don't get any compensation for it. So part of this is recognizing that there's work that family doctors do in terms of planning. There's another fee that they're going to be able to have access to for complex care planning. So if they're going to have a telephone conference call with, say, home care nurses or perhaps a team of people at the hospital that's taking care of their patient in hospital, that they'll actually be able to get compensation for that, whereas previously that wasn't possible.
So you said that these conversations could save them sort of a couple minutes here and a couple minutes there. How does that add up to enough time to take on new patients?
Well, this is not the only piece of it. So part of it is not only the time saving, but the acknowledging that this is taking some of their time, and now they're going to get compensated for it. But there are lots of other parts to this program. We've had 3 pilot projects around the province, and one of the parts of the funding has gone to something called a division of family practice. They'll certainly have a division of family practice in your neighborhood, but the existing ones, it's groups of family doctors that work in a say in White Rock was one of the examples. They get together and they talk about what are the unmet needs of patients in their area. They work with the health authority as well, and then they think about how to use the resources provided to them to actually build some capacity. So, for example, they might hire a registered nurse, or they might hire a nurse practitioner or a pharmacist, a different kind of health provider that will take some of the load away from them and free up some of their time to do things that only a family doctor can do.
So after the pilot project, is the idea that all family doctors will work this way?
Well, it may not be every single family doctor in the province. In fact, it probably won't, but people can take advantage of these new fees. So any family doctor can take advantage of them if they wish to. Not every family doctor is in a division of family practice right now, but my guess is that more of them will join up when they hear about this. And I think that's one of the really good features of the program is that it's really different around the province. You know, the patient populations are different and the needs of communities are different. And so where in one community they might say, we're going to attract more family doctors here by the way we're doing things, another community might say, we'd really like to have nurse practitioners or registered nurses as part of our team, or another allied health professional. That would be the thing that would work best for us. So it in a pilot project, it differed from community to community. Like for example, in the Cowichan Valley, they now have a new maternity clinic where patients can go. They recognized that there were women that either didn't have a family doctor or the family doctor didn't do obstetrical care. And so they now have a maternity clinic based at the hospital where women can go if they don't have a family doctor who does obstetrics. And that's, as I understand it, that's been very successful there.
The other pilot project was in Prince George. We are broadcasting to Prince George right now. If you go now to the website, the BC College of Physicians and Surgeons, it says there are only 3 doctors accepting new patients in Prince George. So how much of a difference did this program really make?
Well, I've got some numbers for how many people have a doctor now that didn't have one before, and there's more than 3,800 patients that didn't have a family doctor that now do have a family doctor.
In Prince George?
Mm-hmm. And they were able to add 8 new doctors. Now, what you're suggesting is that there's still a need there, and that's absolutely true. There is still a need there. So there's still more work to be done. They're still working to recruit new doctors to the community. But one of the things about this is sort of a suite of incentives. So it's support for family doctors and some financial incentives that make the whole idea of being a family doctor something that may be more attractive to people. And so it's certainly in these communities, they've all got at least one new doctor, and I think Prince George is the community that was able to attract the most new doctors of all the 3 communities.
We certainly hear from a lot of the communities that we broadcast to that they just can't attract or keep doctors. So do you think these incentives will be enough for a doctor to decide to live in Fort St. James or Princeton?
Well, for Fort St. James and Princeton, there are a whole lot of other initiatives, like there's other financial incentives that help to attract people there. So this would be on top of those. So I would be hopeful that it will help to get into some of the communities that have really had a difficult time attracting family doctors, that it would help them, that they'd have a better chance to attract someone. We already have loan forgiveness programs, and there's a rural locum program and that's separate from today's initiative. The rural locum program is one where if you're in a real small town, you can have someone come to relieve you on the weekend or for a holiday, and that has been very helpful. So these new programs are on top of all of the existing incentives for rural doctors.
The Health Ministry took a $236 million reduction on Budget Day this week. How is all this going to get paid for?
The funding for this is built into the budget already, and it hasn't been touched at all. So some of this funding was already there. Some of it's new funding, and it's all funding that's been negotiated through the Physician Master Agreement. So it is still all built into our budget. There's not a problem at all with that part of the funding. And one of the things that we really are doing across the ministry, and it's not only with primary care, it's in a lot of areas, is we're shifting resources. We're saying, what are the things that are going to make the biggest difference for British Columbians? And primary care, the kind of work that family doctors do and home care nurses and that sort of first point of contact, that's one of the best places for us to invest, because we know that the more solid that primary care system is, the less people are going to the emergency department, and the less likely they are to end up in the hospital. So it's better quality of care for patients, but it's actually less expensive as well.
Do you know how many people in BC don't have their own doctor right now?
We only have an estimate for that. These are numbers, I think, from a survey, so it's hard to know for sure, but the estimate is that there's about 615,000 people that don't have a family doctor, but only 176,000 of them actually want a family doctor. So there are people who, particularly young people who are healthy, who don't really ever go to the doctor, and they're not seeking one. But we're guessing it's somewhere a bit under 200,000, so it's about 4% of the population that are looking for a family doctor today.
How confident are you that 200,000 people will have a family doctor in the next 2 years? Well,
we're going to do the very best that we can, and I think that there's been a lot of creativity that's gone into this particular program. It's been the Ministry of Health working with actual family doctors, so people who work in the front lines and who have been doing it in some cases for a number of years. And there's a committee that's called the GP Services Committee, the GPSC, that have been working together very successfully for about 10 years now. So we've had people who really they're the frontline people who've helped us to build this program. We've put incentives and supports in that they have told us they think would make the biggest difference. And the other thing that we've done, and I think your listeners probably would know that, is we've got more than twice as many doctors being trained in the province. And we have people being trained right in Prince George and right in Kelowna. Not only that, but the medical students and the residents, so people who are finished medical school and who are now doing their final training to become family doctors, they're actually being trained often in smaller communities. So they're getting exposure to some of the smaller communities in your listening area, they're actually working there, and they're getting to see what great places they are to live and what the opportunities are. So I think all of those things working together is going to give us a great chance to get this to work out by 2015.
We did, however, hear yesterday that only a handful of the graduates from the Northern Health Program were staying in Prince George.
Well, there was 1 year when actually, disappointingly, none of the graduates stayed, but that was an outlier. That was 2011. And I know that Dr. Yago was speaking about that. He really believes that it reflects the students who started medical school in 2005. That was the family practice graduates of 2011. He thinks the selection process has changed so that we're more likely to be attracting students who have a rural background and want to live in rural BC. And certainly the other years, I don't have the exact numbers, but that 1 year there were no students. In other years there have been some students that have stayed in the north. And in fact, when you look at how we're doing in BC, I think we're the second best province in terms of the ratio of doctors to patients in the rural part of our province. So I know it's not perfect, but I think the investments that we've made in rural programs and in training more family doctors, it is starting to pay off.
Dr. McDermott, thanks for joining us to tell us about it. We'll be interested in following along to see how this works.
Thank you very much.
Bye-bye.
Bye.
Dr. Mark McDermott is BC's health minister. And what do you think about this plan? We heard from you yesterday about whether or not you have doctors in your community. Are you confident that the new plan will help with that? Give us a call, 1-855-222-5775, or email us, radiowest@cbc.ca.